Hi, I'm Dr. Mike DiTola, and welcome to What Lies Beneath, a show that looks at what drives some of today's most passionate clinicians to create beautiful chairside restorations. Our show partner is Kuraray Noritake Dental, a company whose world-class adhesive and restorative products allow dentists to provide their patients world-class restorations. In this episode, we will be taking a closer look at the Katana Zirconia Block and its use in creating beautiful chairside restorations. Today's featured clinician is Dr. Meena Barsoum. Meena has a private practice in Arlington Heights, Illinois, and is also a faculty member at CDocs. Meena, thank you for spending some time with us today.
Mike, thanks for having me. Excited to be here.
Well, you've got a great case you're going to share with us. And before we get to that, I did want to ask you just a simple question. Why did you decide to go with Katana Zirconia for this particular case?
Yeah, so it's a good question. I've been using CEREC for over a decade, and I've come across a lot of different materials, and there's a lot of great materials on the market. But since zirconia started getting more mainstream as a chairside solution, one of the biggest things we've been hoping for is an aesthetic zirconia that we can do and deliver in a single visit. So when we get into Tim's case here, it's a 10-unit case that we executed all in one day, and so I can dive into it a little bit if you want as we get into the pictures, but. What you see right off the bat here on Tim is he's lost a lot of vertical dimension. He has a lot of wear. So one of the criteria I needed for a material was something that could be very strong, but also something I can cement, because I knew these were going to be full coverage restorations. They were likely going to be at or below the gingival margin, and not something that I would be able to bond really well with not a lot of enamel. The other thing you notice is, and probably the impetus for Tim getting his treatment done, is he's been missing number 9 for several decades. So the first question I asked him when he came in, how do you like your flipper? And he was very colorful in his description of his flipper. So clearly he didn't realize there was a better solution. That's when we started, working it up.
That's great. And that is really neat to have a material that is so strong that you can have total confidence, because you look at that and I don't know what other material would stand up there. And then the ability to cement it and kind of realize your own limitations about trying to effectively bond something sun-gingival and how it might get contaminated. So it really hits both those notes for you pretty well.
Yeah, and the other thing too with it, he's obviously missing tooth number 9. As we evaluated his cone beam and looked at the bone volume, he was really deficient in that area, and without significant surgery and bone grafting, an implant was not going to work, and he wasn't committed to doing that. So I knew that part of the treatment would be a 3-unit bridge. And again, in the chairside world, we don't have a lot of materials that you can make bridges out of. Emax being one is a lithium disilicate, and then zirconia with Katana. One of the nice things about Katana is I can make those connectors really thin because it is a really strong material, so it looks a lot more aesthetic, in my opinion, as a result. So it just made the most sense to go with Katana for this entire case to restore Tim.
That's great. Okay, so as we look at the next slide, we're going to see that there's that wear you were talking about, and that's a lot. I can see some pulp chambers there, Meena. That's there's a lot of wear when you can see where you would have to do an endo access should you choose to do one.
Yeah, exactly. So, and that was the concern with him is, am I going to have enough tooth structure to restore, and how many of these teeth might need endo? So when we start working up this case, and I'll show you my sequencing and how we plan this with the laboratory to get our wax up made, we knew we were going to have to open up his vertical. So my hope was I wouldn't have to prepare much. Thankfully, he did a lot of the prep work for me, so that saves me time. You sometimes wonder if it's fair to keep charging for the prep if he did most of it. But so that helped us knowing that we're going to open the vertical and hopefully not reduce the teeth anymore.
That would be amazing if he actually asked for a discount because he prepped the lingual for you and now all you had to do was prep the facial. That'd be very
exactly.
Intelligent patient if they asked a question like that.
Yeah. So, our first plan whenever we do these cases, I always take a full arch scan, upper and lower with the prime scan. It's something that's part of our new patient workflow regardless. So I'm able to show the patient these images, 3-dimensional, and I can show him his wear. I can show him the heat map of his bite and where he's hitting. And then the beauty of this is I can send all of this information along with the photos to my lab technician. And now my lab technician can go ahead and actually design a virtual wax up for me, all digitally. So in the next slide, you'll see, go ahead.
No, I was just going to
Sorry,
say it's amazing for Tim to probably be able to see, see his teeth in a way that he's never been able to see him before. You can look at him in a mirror and see him, but patients, when you scan and get those images up there, it becomes much more real, and all of a sudden patients seem to have much more realistic assessments of what their teeth look like and what needs to be done. And it seems like it's a great way to help get treatment acceptance when they have the opportunity. I mean, never mind the fact that it's great for our digital workflow, but it really seems like it motivates patients to follow through when they can see their scan on the screen.
Yeah, absolutely. I mean, so part of our new patient records, we take a series of still images, and oftentimes what the patients do, whenever you put a picture of their smile up on the screen, it's always the same reaction. They just don't want to look at it, and they want you to put it away. But for some reason, when we load that prime scan in, and it's got a touch screen, and they can manipulate and look at their models, it's a lot more emotional for them that they can see their teeth in all different dimensions, as if they had a little camera in their mouth. So it really makes it very, very interactive when we have these conversations. And then I can follow up with them in a few weeks once we get the wax up, and I can say, here's where your teeth need to be. These are the sizes of the teeth. This was done by my lab technician, Bill Murray at Dysa Dental. He did this virtual wax up. And, the beauty is he can send me all of these files. I can 3D print them in my office. He can print them for me. I can integrate a lot of them with my in-lab and CEREC software. So a lot of this becomes a fully digital workflow where we don't have to take physical impressions and have physical models to work on the case. And the next slide here, you can see, here's the preparations. And as I expected, they were going to be full coverage preparations. And we went ahead and took a scan of this. This was, again, in the CEREC software, in the chairside software. And, one of the beautiful things I can do, because I have the in-lab software as well, in the next slide, you'll see I was able to take both files and stitch them together and then use that actual digital file to create my design. So it makes my design work extremely simple. The lab technicians are the experts when it comes to these types of things, and he did a great job for me. Why change it, right? Let's utilize what Bill gave me. So I was able to copy all of those designs over my preparations. And then in the next slide, you'll see it's a perfect stitch when I can draw the copy lines, and then here's the final proposal on this slide. And this is what the next slide is going to show you, the bridge. It's a 3-unit bridge, but you can notice I was able to design nice intersecting connectors. It looks very aesthetic. Created a nice Ponte space that matches number 8. So aesthetically, we were able to mimic the entire design from start to finish.
That's great. And it looks like just when it comes to the preps, it looked like you dodged endo on any of those preps. I don't know. I didn't see any access openings. Were you able to get away without doing endo on those severely worn teeth?
Yeah, I mean, so I didn't see it. I mean, there were no pulp chambers. Nothing was bleeding at me when I finished prepping those teeth. And we completed this about 3 or 4 months ago, and I haven't seen him since, just COVID and various reasons, which tells me he's probably not in pain and he doesn't need endo. So that's a good sign. So I think we're in good shape on those. And then bringing it back with that stitch, and the CEREC users who've seen this, this is kind of the gold standard when you can see a perfect stitch of the design and the wax up. Now, all I have to do is simply manufacture these. And in the next slide, you'll see here's the manufacturing on the prime mill. And this was done, the 3-unit bridge was milled in extra fine mode. This is Katana Zirconia. These were all natural white shade. And they were milled in, everything was done in a single visit. So this was about a 4.5-hour appointment, start to finish. I do have the luxury of 3 milling machines, so I was able to send a lot of the cases at once. And then the other benefit I have with Katana is the sintering time. So I can take this case from the mill, and in about 18 minutes, that restoration is sintered fully and ready to be cemented. So we can constantly be going back and forth from milling, flaring, and seating the restorations. So we're able to always be doing something in that visit. So I can take a 10-unit case and complete it in about 4.5 hours. And that's a great day. I mean, if I'm done by noon, I'm home, right? So I've met my goal for the day and I'm done. And it's a great, rewarding way to kind of treat some of these patients, especially when it's wear and they can go home very instantly with a huge improvement.
Yeah, that's incredible, because you see somebody with a bite like that and who's done that kind of damage, and you just would have to worry about the temporaries every second that they were in there. If he did that to natural enamel, what's he going to do to this bisacryl material? So yeah, that is one of those cases where not only is it just fantastic for the patient to see their smile change in a day, but I mean, imagine all the trips back and forth destroying probably temporaries if you were doing a traditional kind of 2-week turnaround. So you're able to sinter the 3-unit bridge in about the same amount of time as the single crowns?
Yeah, it's a few minutes more. It's about 23
Okay.
minutes or so, 24 minutes to sinter it. But, I have multiple speed fire furnaces. I have multiple milling machines. So basically, I prep the teeth, I design, and then my team takes it from there. They handle all the milling process, they fire, and then we come out. And this was simply polished. When you see the final results, I didn't do any staining and glazing on this. I just allowed the zirconia itself and its natural aesthetics to just shine through. So you get really nice luster and texture on the surface, and I don't have to recreate kind of that multi-layer translucency and chroma that you see in natural teeth because of that multi-layer zirconia that Katana gives us.
And you made Relic Christensen happy because you didn't glaze your zirconia. You left it polished because we know he's going to create a ton of wear. He's got tons of muscle activity, and it's nice to know that we have polished zirconia now against those opposing natural teeth. That looks fantastic. When he finished, did he say anything about the lowers? Do they look so good that he's thinking about, oh, I need to whiten or I need to do something else to the lower teeth?
So yeah, so it's funny you say that. We actually scanned him. So anytime I do a case like this, before they leave, they're getting scanned for a splint. So I
Mm-hmm.
scanned him for a splint, and then we printed some models because he now wants to do some whitening on the lower teeth. And that's just been the process of getting him back in with COVID and things like that. He's just a little bit nervous, but yeah, definitely. I mean, it just changes their impression of how they view themselves, and he wants to look better everywhere. So he's going to whiten the lower teeth, and eventually, if you notice, he's missing his molar, so we need to get him some
Yeah.
first molar occlusion. So we're working on an implant workup for him, and he's just trying to kind of balance his financials to get to that point.
Yeah, well, good for you for doing it in the order where you gave him his self-esteem back first and showed him you could do it. And now I'm sure he believes that you can do anything, including the implants and all the other stuff. I mean, sometimes we've been taught to hold off what the patient wants until the end and do the other stuff. But I think it's fantastic that you've given him the ability to. Did he take that flipper and crush it with a sledgehammer afterwards? Did you
Yeah,
have some
yeah.
sort of celebration
He
like
didn't.
that?
It's funny you say that. He actually showed up to the office without it. He's like, I know I'm not going to need this after today, so I didn't even bring it. I'm like, oh, pressure's on. I got to deliver today. So it was good. He was
I
super
like that.
thrilled and happy.
I like that amount of confidence he has in you that,
Yeah,
I didn't
exactly.
even bring it. I know there's no possible scenario where I could ever need this again. It's funny. You and I spent a lot of time in dentistry when, bonded restorations were kind of the end all be all, always superior to cementable restorations. And of course, zirconia has kind of changed that in some ways. And you had full contour restorations here, and you chose to cement it. Do you like that peace of mind of being able to cement it, not have to worry about contaminated bonds or anything like that?
It's such a game changer, honestly, when you think about how difficult it was to isolate and bond and make sure that the stars are aligned perfectly to get a reliable bond on bonded ceramics. And now using a resin modified glass ionomer that I know is going to release some fluoride and protect those margins. And he's not caries prone, but who knows, right? So I want to make sure that I give that restoration the best longevity possible. And I've come to realize, I mean, I'm pretty pessimistic when it comes to dentistry, and I always assume I'm going to have to replace things down the line. His natural teeth didn't last forever. So in 20 years, if somebody has to replace these, they're going to be much happier with me that they're cutting off cemented restorations versus bonded restorations. So again, those things always kind of start to play in. And having a material like Katana that is strong enough to cement without losing any of that fracture toughness or flexural rigidity on the tooth or on the restoration, it's a huge benefit to us as clinicians to not have to worry about it.
Yeah, I totally agree, and I think that's a great use. This, to me, is almost a perfect case to share with us today because there's really almost no other material. It was kind of screaming out for zirconia because of how powerful his bite was, and your choice of Katana Zirconia paid off really well, looked really nice. Fantastic that you were just able to polish it, not have to stain and glaze it, get an amazing result. And that's living the dream, Meena. You're right. You get your production goal done by noon for that day, and you can kick back and do whatever that afternoon. And to have somebody that happy who's going to go out and tell the world and smile at everybody and show them what you did, that's got to feel great.
Yeah, it's a rewarding thing, and especially when we get a lot of these cases, these are the ones the team really remembers and focuses on. So it's if I can get one of those a month or a couple a month, that's a great practice for me, and that makes me excited to keep doing what we're doing.
Well, one last thing as we wrap up the show, the name of the show is called What Lies Beneath. We always like to see something that lies beneath. And so I either want to find out what lies out beneath your passion for dentistry. So if you have a good story about why you originally got the thought to become a dentistry, or you can show us what lies beneath and show us what socks you're wearing right now. So I'm going to leave it up to you, because I don't know if you happen to have some bizarre socks on that the crowd would like to sing, or if you want to tell me your origin story, or both.
Yeah, I'm looking at my socks. So I don't know if I'm flexible enough to get them up on the camera right now without pulling something. So I'll, it's interesting. My history. I was initially in medical school when I graduated from high school. I got into a 6-year med school program, and my family growing up, we had a lot of physicians in the family, and I got accepted to this program, and I was ready to go. And 2 years of getting a 4-year degree. I got a 4-year degree in 2 years of undergrad. I was completely burned out, and I finally listened to my family members, and they said, maybe look at something else. Medicine isn't what it used to be 20 years ago. So I just happened to be at my dentist's office that summer, and I was telling him the story. And he's like, "Why don't you just hang out with me for a couple weeks?" And just kind of watching his ability to kind of move about and take care of patients, but still be an entrepreneur and still be an independent business owner. And that was something that I always kind of had that passion for. So it really made me, consider dentistry very seriously. And I took another year just to get everything planned out. And then I went to dental school. So, and I could never imagine doing anything else. So it's been awesome to have the luxury of practicing and treating patients like Tim, and also being able to travel and teach dentists how to use this technology with CDocs. And it's just been super amazing for the last decade of my career.
What an amazing mentor that Dennis was, to say, "Why don't you come hang around for a couple of weeks?" I've never really had, if I told somebody hang around for a couple of weeks, I'd put them to work, changing all the suction traps and right. Everything else. But it's great that this dentist felt like wanted to share it with you and just let you kind of watch, and obviously saw something in you or knew you were serious and you weren't just there for whatever reason. So that's an amazing story. There's so many of us that had, like myself, a father who was kind of the role model to do it. And it's amazing to hear that somebody who was just your dentist did that. And I'm sure you're going to do a great job of passing that same type of mentorship on to some young prospective dentist who might come up to you at a meeting or somewhere and ask you if they should do it or not. Great story, Meena.
Yeah,
thank you for sharing that, and thank you for being on What Lies Beneath with us today.
Thanks for having me.
Well, that will wrap it up for this episode of What Lies Beneath. So on behalf of myself, Kuraray Noritake Dental, and Practice Passion, I want to thank you for your time and your continued commitment to quality dentistry.